Good afternoon, everyone. My name is Sergeant Solorzano, as the majority of you know. I have been the champion for the process improvement of creating an enduring mission versus an expeditionary mission. I've called you all here today for us to just talk about this a little bit, about the implemented changes that are going to happen over the next couple months, and then what we're looking forward in the future. I know we've all sat together and we've all talked about this, and we've outlined our goals, and we've all had the ABCD event, very much like a Six Sigma, where we've kind of figured out what our LIMFACs will be in this transition. But just let's make sure that everyone here is on the same page. Just to let you guys know, the reason that we are transferring to an enduring mission versus an expeditionary is that we are showing this country that we are here to stay. We've been here since 2003, and when we came here in 2003, it was strictly operational. But as our relationships with the government here have progressed, we have been provided a very unique opportunity to really grow this area with our families. And so that really shows the government that we're here to stay and that we're serious about our mission here. Now, to do that, though, there's a lot of unique things that come along with that. And most importantly is taking care of our families, because in the Air Force, that's what we do, right? We take care of our families. So that's what we're working on and working towards, is how can we continue to provide trusted care anywhere, but really expand that to support our family members. So knowing that our family members could range anywhere from a newborn infant to 50, 60-year-old dependent spouse, right? So with that comes a lot of unique pieces. So we're just going to run through each section of who is affected by this, so that we can really plan our way ahead. And of course, at the end of this, we're going to have questions and discussion, and then we'll set up a time to go over this again, because of course, once we implement these changes, we're going to have to go back and look at the data and make sure that the things that we've come up with are in fact going to lead us to our final goal of this enduring mission. So the PAD team. So number one, the PAD team. So patient administration, that is your job, right? Like, your job is to be the face. So there will be unique things that these folks come in for. And so you have to make sure that you understand each other aspect of care. So we'll go through them. So family practice, we've already put in the request for a pediatric doctor, but at this point we don't have one. We foresee that in the near future, probably within this next 6 to 9 months. But until then, our pediatric patients will be seen by one specific provider. Lieutenant Colonel Johnson will see them. So please know, PAD team, that Lieutenant Colonel Johnson will be the POC for any pediatric patients until we get a certified peds doc in. Lab supplies have already been ordered. Butterfly needles have already been ordered in the event that there needs to be a pediatric blood draw. All of those things have already arrived. So you guys should be good to go for that. So please, everyone, know that lab does have the materials that they need to support this. Pharmacy. So pharmacy has kind of requested some different medications that they could foresee us needing. Again, in this area, this is not something that we can just get on hand. So we've gotten enough supply that should support us for a little while. Immunizations. Okay, so immunizations, we all know that children require certain immunizations based off of CDC recommendation in certain increments. Now, those are immunizations that prior to this, we have not carried in this location. So those immunizations have been ordered based off of a permanent party number of 200 some odd permanent party, and about 15% of those bringing their families. That is what we have based our need for immunization off of, because folks, we can't we can't guarantee what age children we're going to be supporting. So we have to be ready for anything. But at the same time, we have to respect the Air Force's money and not over order something that is going to expire before we can use it. So we definitely still need to be considerate of that and be good stewards of finances. So immunizations we have. Radiology, the radiologist, I mean, we already do these different radiological exams. But just forward thinking, kids will be kids, right? And so just forward thinking for those pediatric patients and having things that would support them during that time, even if it's a teddy bear. Folks, these are the small, tiny things that we need to think of outside of the box. And that's why I wanted to bring us all here today, so that we can kind of just get this overview of why we have to do this, what our goals are in doing this, and then any questions that we have. So I think we've kind of touched on the mission, the expectation, what our availability is of supplies, and our procedural changes. And so at this time, I just want to open it up to you guys. Let's talk through it. Let's discuss it. Let's go through all these questions. Let's talk it out as a team. And then after the questions, we'll schedule a time to come back in about 30 days so that we can just reevaluate and see how we're doing and what changes we can improve on. So at this time, I open it up to you for questions.